about the myths involved in what we're taught uh, regarding diabetes, especially type 2 diabetes. Number one, probably the biggest flat out lie and deceitful tactic that's out there is that if your parents have type 2 diabetes, you're going to have it because it's a purely genetic disorder. And that couldn't be farther from the truth. There is no peer-reviewed research that is definitive on that. We know that type 2 diabetes was once called acquired diabetes, and it's lifestyle related. So when people are given that information, they assume wrongly, unfortunately, that there is nothing they can do other than take insulin and just wait for the decline of their health over time, which unfortunately does occur. So that's a really big flat out lie. The second myth or lie is that exercise is the key element in controlling and reversing diabetes. And this can apply to both 1 and 2. And that's another, not a lie, but it's an inaccurate statement, and here's why. A diabetic is not a healthy person in general. They usually have cardiovascular disorders, digestive disorders, kidney problems, maybe they're on blood pressure medication. So there's several other factors involved than just their sugar being out of order. So to assume that just throwing exercise at a person who's already unhealthy is going to get them corrected is just misinformation, and it leaves the person in a bad state. And the number one reason is that exercise will do two negative things to that person. It will make them more acidic because, remember, exercise produces something called lactic acid, which will further acidify a body that's already acidic. And that's a whole other topic, but we want to get away from being acidic, and we want to get more alkaline in our bodies. So again, the second most debilitating effect of exercise is if you get injured, or you do it for a few days, you don't see any change in your blood work, and then you get demoralized. So we need to really think about the neuroemotional components of people, and how they can relate in their daily life. So those are two key components that I think will really help get back some myths and hopefully get you or someone that you care about looking at things a bit differently and really get involved in resolving their type 2 diabetes. I lost my father and two uncles to the complications of type 2 diabetes at a very young age, in their 50s and 30s, and I'm committed to helping you get some real facts and information.